I've never had anything like this in my career. I don't think many people in the lab have. I'm working with physicians and other specialists that we traditionally don't as a pathologist. And the other lab professionals, they're out there on the floors in a different way, working with other people in ways they never have before either.
Worked really closely with the lab leadership and hospital leadership on bringing in COVID testing and working on testing plans and algorithms for our patients. When we were sending testing out before we had the test in-house, our turnaround time was anywhere between 1 day to 5 days, depending on which reference laboratory we were sending it to. But now that we have the test in-house, we are able to have results available within 4 hours and more often less than 4 hours. So that's made a huge difference in our ability to take care of our patients and identify the COVID patients faster. It really depends on how acute the patients are. So the patients that are going to be hospitalized, obviously they're staying here, they're being admitted to the hospital, and those are the patients that we're prioritizing that we want to get the results very fast. So hopefully by the time they get to the floor, they'll know whether or not they have COVID.
I think for the phlebotomists, we've had to close some outpatient sites and have them come over to regional and learn the processes here, which is a huge undertaking. It's a whole different process. We've had to staff 24/7, which usually in the outpatient world you work 8 to 5 hours. In an outpatient environment, you have predominantly pretty healthy people, routine lab work, like your cholesterol and things like that. There's a lot of isolation patients, which never happens in the outpatient world. All these little challenges that a phlebotomist doesn't encounter in the outpatient world and they do here.
Laboratory services, I mean, they're critical in the care of most hospitalized patients and not just COVID patients. So COVID patients, we need to test them to see if they have the disease, if they're positive for it. So it's very critical in the diagnosis. And then it's critical in supporting the patient, because once they're diagnosed with COVID, they still need the support and care that comes along with most hospitalized patients in their daily labs. I think it's really brought the team together, and not even just the lab team. I think it's kind of brought Renown Health system in general together.